Today, we're shining a spotlight on an important health issue, especially for communities of color. The Health Equity in Transplantation Coalition is a movement spearheaded by the Reverend Al Sharpton and the iconic R&B singer Al B. Sure. They have teamed up to pressure Congress to reverse a decision by Medicare that cut off access to non-invasive blood tests that catch signs of organ rejection in patients after they've had organ transplants, which disproportionately affects Black and brown people. Simone sat down with Reverend Al Sharpton and Al B. Sure, who received a life-saving liver transplant last year. Here's that conversation.
This is such an important issue. I mean, you are someone that received an organ transplant. Can you just explain how important this test is post-operation?
First of all, thank you for having Reverend Sharpton and I. I am the walking billboard for transplant. You know, people see me and they say, hey, you know, you don't look like what you've been through, but it's a serious issue. And it's been quite a journey back to health and wellness. So I wanted to dive deep in head first and really tackle this. Rachel Nordlinger, she said, you know what, let's create this coalition and bring along the most powerful voice in bringing unity and bringing equity. Of course, that is Dr. Sharpton. And finding out what the logistics were related to a decision that was made in the dark to stop Medicare coverage, Medicaid, for the blood testing that's so significant to our lives. See, the most important thing for a transplant patient is going into rejection. And so I wake up every day being concerned about that. Now, mind you, there are thousands and thousands of patients who are affected by this Medicare, the coverage that is not being taken with the blood testing to basically know if you're going into rejection in time, because when you do go into rejection, and that's something that you have, you know, it happens immediately, and then you are sick, and it's almost impossible to recover from.
You know, this is, at the core of this is absolutely, yes, an equity issue. When you talk about the people that are on Medicare and Medicaid, Rev, these are the folks that need it most. You know, if you're not on Medicare and Medicaid, you could probably afford to pay for the post-op test, right? Pay out of pocket for it. This issue has sparked bipartisan concern on Capitol Hill in Washington, D.C. It's just not Democrats, it's Democrats and Republicans. You were recently on the Hill advocating for this and many other issues. I joked, is there an issue Reverend Sharpton is not involved in? He is the most powerful voice on this. So what progress have you made? What are people saying?
I think, first of all, when Al B., who I've known throughout his career, and everybody has been a big fan, when he got sick and had to get a transplant, and I was keeping up to date, he was in the hospital, his mother and others, and Rachel Nordlinger, who, you know, would fly back and forth, she's a media mogul now, and she would say to me that this transplant thing is serious. So when he got out and he started studying what they were doing to transplant victims or patients who became victimized, as this new rule, he came to me and Rachel and said, we need to get somebody out here on this. Who do you think we get out here? I said, me, because this is wrong. Yeah. And it is, first of all, because the government gave it into a private way of dealing with this, who just decides, well, blood tests, we're not going to do that anymore. And it's not like they have time to correct it. If you are rejected, if the transplant is rejected, you almost immediately fall and could go. How can we allow the government to do this? So they called me a couple of weeks later. You know, Rachel makes things happen that shouldn't happen, or couldn't happen.
She's a magician, as I like to say.
That's right. Absolutely. And she called me on the phone and said, Newt Gingrich wants to work with y'all because he has a relative that had a transplant. So this transcends just race and class. This is about people having the right to say, my Medicaid should be able to cover me with what it was already doing. But this, they brought this other entity in that stopped that. Well, we cannot allow that to happen.
So what do you hope I guess the outcome of this effort, or when, would be for the testing to go back on the list of things that are covered?
Absolutely. It's called reverse the decision. You know, we had an opportunity to meet with the vice chair of the Congressional Black Caucus, Yvette Clarke, and Senator Kirsten Gillibrand, most of the congressional leaders, and as Rev said, the most significant part about it is, see, I'm not there for the politics. I'm not there for the next election. I'm strictly there to save lives of transplant patients. And me being the walking billboard of the severity of all that had transpired, while I was down. I don't like to use the word coma, so I'll say I was updating my software.
There we go.
Yes, ma'am. So we're just really looking forward to taking, our senior advisor and just the powerful voice of what Reverend Sharpton represents around the globe to bring attention to this, as is what he does with, police brutality cases. When you ask Reverend Sharpton and people try to scrutinize and say, you're doing this for attention, and Reverend Sharpton calmly says, absolutely.
Yes.
I need to shed light on this. And that's the brilliance of Reverend Sharpton. And so I'm elated that he's decided to work with us. It's the Health Equity and Transplantation Coalition, and I am the executive chairman. Blessed to be the executive chairman.
And because I'm on Simone's show, and she has a cultural bent, I just want you to know, between you and I, nobody else knows this. I think Albie and Rachel's dating.
Oh, are they?
I just thought,
I mean, I was wondering how
I
she
wouldn't
got
say that
Albie
on
Shore,
Politics
honey.
Nation.
I was like, well, greetings, sir.
I think I get some tea since I'm coming up.
Well, I appreciate, my cup is full. Reverend Sharpton, Albie Shore, I appreciate you both, Rev. We love you, but Albie, I just want to reiterate what Albie Shore just said about you, because yes, you understand uniquely the power of the media, and you use it to raise and elevate issues that otherwise people wouldn't be talking about, such as this one right here.
Well, I have had some things I'm proud of in life. One of them is my little sister.
Absolutely.
She's the fabulous. I mean, what she's done in activism and television is unprecedented.
And I am a fan of the show as well, and I watch you religiously. And, as I'm going throughout this physical therapy and this journey back to health and wellness. And so you've always been a bright light on what television has come to be.
Oh, thank you.
So we appreciate it.